How to remove calcium deposits from arteries. Calcium is good for the bones, but not when it is lodged in the arteries. Along with fat, calcium deposits in blood vessels constrict blood flow, resulting in a host of fatal diseases and conditions, not the least of which are heart attack and stroke. Atherosclerosis is a condition in which the arteries harden due to this mineral buildup. Even if atherosclerosis does not result in total blockage, the hardened deposits in the arterial wall can break off any time and create blockage along the way, which can cause a stroke or the lack of blood and oxygen supply to vital organs, the foremost of which is the brain. Like most fatal diseases, atherosclerosis is best prevented early rather than cured. If there is already buildup, the process of how to remove calcium from the arteries may take a while, so you need to be patient and persistent. 1. Consume more vitamin K2. A breakthrough research study has found that vitamin K2 not only helps the body absorb more calcium and deposit them in the bones, but it also removes calcium by as much as 37% from where it does not naturally belong. This means that calcium in the arteries could be flushed out with sufficient K2 in your diet. This is because K2 binds with calcium and directs it into the skeleton. Foods rich in vitamin K2, which is a fat-soluble vitamin, are hard and soft cheeses, egg yolk, ground beef, chicken liver and breast, salami, and butter. 2. Reduce your dependence on statin drugs. Statin used to be prescribed to help lower cholesterol levels to patients at risk of stroke or heart attack. This is because cholesterol clogs up arteries. Recent studies indicate, however, that statin has cardiotoxic properties because it makes the heart muscles weaker. Statin also damages nerves, which will aggravate hardening of the arteries and further result in cardiovascular failure. 3. Wean yourself from blood thinners. If you are susceptible to strokes and heart attacks, you have likely been prescribed blood thinners to allow your blood to pass through the narrowing of the arteries and to prevent clogging. Blood thinners, however, particularly those containing warfarin, promote calcium buildup. So while they may prevent coagulation in the short term, they actually aggravate mineral plaque in the arteries in the long term. 4. Consider chelation therapy. If your arterial calcium buildup is far too advanced, complement your vitamin K2 diet with chelation therapy. This therapy uses a synthetic solution, ethylene diamine tetraacetate acid, or EDTA, to flush out heavy metals and minerals from the bloodstream. EDTA does this by binding to the metals and minerals and exiting the body through urine. You may have to consider carefully the potential harm of this therapy, as its use in removing calcium from the arteries is yet to be further studied. 5. Undergo carotid endarterectomy. In serious cases where it warrants aggressive intervention, as in the case of patients who have had strokes without hope of full recovery, have suffered heart attack or congestive heart failure, or are showing signs of progressive mental deterioration, all due to blocked arteries, a vascular surgeon may have to scrape the calcium buildup in the carotid arteries. Found in the neck, they are the major suppliers of blood to and from the heart and brain. If tests show that the arterial calcium buildup is somewhere else, an endarterectomy may also be performed since plaques can break off from that buildup, travel in the bloodstream, and cause clots. In sum, taking preemptive steps on how to remove calcium from the arteries is crucial, as calcium is harder to dissolve than fats by mere exercise. The earlier you withdraw from artery-damaging health habits and practices, the better your chances of avoiding serious health risks.